Assalamu alaikum. My name is Dr. Asad Malik, and today our topic is thalassemia. It is a disease and disorder. Okay, it is also a genetic disorder. Now come to the introduction. This is a genetic disorder characterized by diminished synthesis of globin chains of hemoglobin. So there is a diminished synthesis of globin chains in hemoglobin. It is also a genetic disorder. It is also related to the hemoglobin disorder and blood disease, thalassemia. This disease occurs due to abnormalities in the genes that are responsible for the synthesis of the globin portion of the hemoglobin molecule. Okay, it is a genetic problem, so there is a defects in the genes which are responsible for the synthesis of the globin portion. So globin portion producing genes are lack, or there will be a problem in that part which help in production of globin portion of the hemoglobin molecule. So thalassemia are named according to the deficient chain. So when there are two chains in hemoglobin, alpha chain and beta chain. So when there is a problem in alpha chain, it is known as alpha-thalassemia. When there is a problem in a beta chain, it is called as beta-thalassemia. Okay, this is for the assigning the problem in the chains. Come to the alpha-thalassemia. This disorder is characterized by deficient alpha chain synthesis. When there is a deficient or disorder in the production of alpha chain synthesis, it is known as alpha-thalassemia. Usually due to the deletion of the alpha globin genes. Okay, there is a problem or deletion or in problem in the synthesis of alpha globin genes. So there is a missing in the alpha globin genes which help in alpha chain production. So it is known as alpha-thalassemia. RNA for alpha globin gene is not present in alpha-thalassemia. So there are RNA which give instruction to produce the alpha globin gene. These are not present in alpha-thalassemia. Now come to the beta-thalassemia. This disorder is due to the absence or malfunction of the beta globin gene. So there is a beta globin gene lacking. So beta thalassemia is most common type and is seen in the Mediterranean areas. Clinically, the beta thalassemia can be classified into following types. So there are three types of beta thalassemia disease or disorder: beta thalassemia minor, beta thalassemia intermedia, beta thalassemia major, or Cooley's anemia. So okay, there are three types in beta thalassemia disorder. These are some cellular structures. It is a normal cell, and these are thalassemic cell. These are the cells which are during thalassemia patient. These are the cells of the thalassemia patient, and it is of thalassemia major. Okay, these are the destructions to the cell. Okay, now come to the clinical features. There are some clinical features in beta thalassemia minor. This is a common carrier asymptomatic state. In this type of anemia is a mild or absent. This type of anemia is not transfusion dependent. The patient can live full normal lives. The RBCs are hypochromic and microcytic with low MCV and MCH. So it is a normal condition of beta thalassemia. It is at minor level. The patient can survive or can live a normal life. So there is no need of transfusion of blood. So it is not transfusion dependent. Okay, the RBCs are hypochromic and microcytic with low MCV and MCH. Now come to the beta thalassemia intermedia. In this type of thalassemia, the patient has moderate anemia with splenomegaly, and he may rarely requiring blood transfusion. Okay, in this condition, beta thalassemia intermedia, there is a splenomegaly. You can see the splenomegaly. There is a symptom. So a spleen get enlarged, and there is normally there is a need of blood transfusion, but in some cases. Okay, now come to the beta thalassemia major or Cooley's anemia. That is a severe condition. This is a severe disease that appear in childhood and may be fatal by 30 years of age. So, okay, it is a severe condition of disease. It appears in the childhood and may become fatal to or at 30 years of age. And the affected children present with, so there are symptoms in the children. Skin is greenish brown. First of all, the child skin is greenish brown. Discoloration is due to jaundice and hemosiderosis. So there is two problems. There may be two problems. One is jaundice and number two hemosiderosis. So skin becomes discolored and becomes greenish brown because there is a problem in the liver. Liver and spleen are massively enlarged. They both become enlarged, liver and spleen in thalassemia. Okay, liver and spleen are massively enlarged. Physical growth and sexual maturation are markedly impaired. So there is an impaired or problems in related with physical growth and sexual maturation. Increased susceptibility to infections and fractures. So the child becomes easily infected with the virus and bacteria, and fractures also are. It is very easy to become fractured. Repeated transfusion is associated with transfusion reactions and hemosiderosis. Okay, transfusion also becomes the problem for the children. There are many problems of transfusion reactions, and hemosiderosis, resulting in cirrhosis, cardiac failure, and diabetes mellitus. So it is a severe condition. There is cirrhosis, cardiac failure, diabetes mellitus. Many problems there in thalassemia. And cardiac failure is the main cause of death in thalassemia major. So person died because of the cardiac failure, not any other problem. So it is a major problem of cardiac failure during thalassemia major. Now come to the diagnosis. When we see the blood picture, there is a microcytic hypochromic anemia. MCV and MCH are decreased. Peripheral blood picture shows abnormal forms including target cells, poikilocytosis, and stippled cells. HbF is increased. HbA2 is increased. So these are the blood reports which can be shown or which can be observed of thalassemic patient. Now come to the bone marrow study. Hypercellular bone marrow. There is a hypercellular bone marrow. Now X-ray skull of a child with beta thalassemia showing the hair on end appearance. X-ray hand showing expansion of the marrow and thin cortex. These are the X-ray observations. Now come to the treatments. The line of treatment is based on the type of thalassemia. The aim of treatment is to suppression effective erythropoiesis, prevents bony deformities and infections. Okay, there is a prevention of bony deformities and infections of the patient, and there is also a suppression of effective erythropoiesis. Now come to the blood transfusion. In thalassemia major, packed cells transfusion should be given every 4 to 6 weeks to keep the hemoglobin above 8 to 10 gram per 100 ml. This is a normal range, so it has to be maintained 8 to 10 gram per 100 ml hemoglobin in every 4 to 6 weeks. So it may be observed. Iron overload caused by repeated transfusion may lead to damage to the endocrine glands, liver, and pancreas. When there is increased level of iron, so they it may produce problems for the endocrine glands, liver, and pancreas. The iron chelating agents are given to avoid the iron overload. Folic acid 5 mg daily is also given. Folic acid is very useful in blood diseases like hemoglobin diseases. It is also prescribed. Folic acid 5 gram daily is also given. Splenectomy is also advisable. Bone marrow transfusion may be done. So these all are the treatments and blood transfusion related with the thalassemia. Okay, that's all.